And frontal molding technique is, the good news about frontal molding in your level of understanding, for some of you, you don't really have to worry which side is internal and external, because what you're going to do is you're going to actually reset the entire frontal bone, and you're going to reset both sides of it. So it's not as specific as far as correcting one internal and one external frontal bone. The whole idea behind this technique, just like a lot of the cranial techniques, is to maintain the tension as you're going through the respiratory cycles. So you contact, so let's say, for example, this poor guy has a skull tilt that looks like this, okay? So it's high on the left. I'm going to contact both frontal angles. I take my thumbs and I cross them over either side of the metopic suture. And again, this is one of those techniques, you're going to do the whole thing through inhalation and exhalation. So as you asked a minute ago, you don't have to really worry about kids in this one because you're going to do the whole process through both respiratory cycles. And what you're going to do is you take your fingers that are on the frontal angles and you lift the frontal angle towards you and you traction it out. At the same time, you use your thumbs to press opposite sides of the metopic suture. So you're doing this, it's kind of opening up the frontal bone. Through respiration, you go inhalation, exhalation, inhalation, exhalation, inhalation, exhalation, and when you feel it release at these frontal angles, then what you do is you hold the frontal angles in that position and you start to spread the metopic suture. So you push the metopic suture apart. You're spreading it at the same time. So you're basically disengaging the entire frontal bone. And then on the last phase, when you've gotten to the point where you've gotten everything set, as the patient inhales, on the last exhalation, you take the low side of the frontal and you push it towards the high side. So you're creating excess dural tension and then you relax it. The frontal bone is one of the bones in the body that actually works really well correcting the rebound motion. So even when we do intraoral frontals, what we do is start to facilitate the lesion first, set up a dural tension, and then we correct the lesion. So what we're doing in the frontal is you're pulling, opening up the frontal angles, when they open up, you're spreading at the metopic suture, and then at the last exhalation, you move from the low side to the high side. As soon as that's done, what you're going to do is you take your contacts, so you move your contacts from here, you take your contact to here on the frontal angles and onto the zygoma, and what you're going to do is you rock the frontal back and forth, what we call the frontal fruit jar, and then you move your fingers to the maxilla and you move it back and forth. And the whole idea of that is to reset the dural tension in relationship to the facial bones and to the frontal cranium, because the frontal is that barrier between the facial bones and the cranium. So once you've set it onto the cranial dura and you've set the anterior pole of the fox, you're going to come back here, you grab the angles, you rock back and forth. The first, when you're doing the zygoma, you're trying to free the zygomatic frontal suture. The second time when you grab the maxilla, you're creating the relationship, or you're moving the relationship between the frontal bone and the glabellar up interior of the maxilla. So it's a two-phase process. You move through that, and you move the frontal bone. If there is a TMJ problem, also this is a good one, if your patients are coming in and the child's having teething issues, and after you correct the frontal bone or the maxilla, then you come back here, and the difference between the craniofacial technique is you're going to grab the frontal bone, you grab the entire face underneath the jaw. What you're going to do is you separate the face from the head, and then what you're going to do is you roll the cranium back and forth. So in the first fruit jar, you're actually moving the face back and forth. In this one, you move the entire cranium, you separate it, and then you move the frontal around it. It's just a global dural release. So if they're having any type of TMJ issues that are involved with the frontal bone, if you notice that the jaw is deviating and open, if they're having teething issues, if they're grinders at night, a lot of times parents will bring their kids in, especially teenagers. They'll say, man, I walk by her, her room at night and I can hear they're grinding their teeth away at night, because it seems that 12-year-old girls tend to have a lot of angst more than 12-year-old boys, so they tend to be grinders more. I don't know. I had girls. I had no experience of having boys except for being one, and I was perfect, so I didn't have any issues growing up. Right? Alright, so we're going to do this frontal correction, and then we'll go to the intraoral. So I'll show you how it works on 1, 2, 3.
Quick question.
Yes, sir.
On the jar ones, are we worried about respiration?
No, not at all. They're just manual dural releases. No worry about that at all. Alright, so. Oh, there's no hole. It's just stuck your hair in the hole. It's okay. So you look at the person, so in Aaron shows a slightly higher left side. So that's the side I'm gonna drag the frontal to when I'm done. So I'm gonna contact the two frontal angles, and it's very important, you wanna be on the angles of the frontal, you do not wanna cover that suture. If you do, you're just done. So you contact over the metopic, again, do not be on the bregma, you wanna be anterior. And as she breathes in and out, I'm constantly pressing on these angles and pulling them towards me. So I'm basically trying to do this with the frontal bone, like you're opening it up. So I'm holding these angles, she breathes in, breathe out, breathe in, breathe out, breathe in. As soon as I feel these angles release, I hold them up, breathe in, and I'm spreading the metopic suture. One thumb's going one way, the other's going the other. Breathe in, breathe out. As soon as I feel the tension release there, breathe in, and then as she breathes out, I move the entire frontal towards the high skull side. Then I take my hand, I come right around immediately onto the frontal and zygoma, and I just work back and forth, make sure these angles are moving. If one's a little restricted, then I'll work that angle. Then as soon as that releases, I'll come back to the maxilla, distract it slightly, and rotate it back and forth, and I'm looking at the glabella, there we go, for motion. And then if I feel the need, if they have a TMJ issue, I'll grab the entire mandible, I'll stretch the head this way, and I'm now going to roll the frontal around the contacts. Good. And then I'll come back and check, and the angles should be even. Breathe in. Good. The head actually usually should stabilize a little bit, unless there's something else going on. Just take a breath in. And when you look, the head should be a little more even. A lot of times when you do the frontal work, you'll see the face blanch. That's good because you're changing dural stresses, so you're going to see blanch, you can see ischemic areas start to get blood and all that. Okay? All right, let's do it.